The procedure for Tribella, we want to start with prepping the room. First, have 3 to 6 towels in the hot towel cabinet and wear gloves. Check the time. A full treatment is no longer than 45 minutes. Now we're going to cleanse the skin. Remove any makeup using the Micellar Rose Water Makeup Remover. Cleanse the skin using IS Clinical or the Purifying and Balancing Facial Cleanser. Wipe the skin with alcohol. Now let's start the treatment with IPL. Get yourself goggles and place the proper goggles on the client. Set the Venus Versa machine to IPL and make sure the correct applicator is attached and select the client's skin type. Keep in mind that settings should be slightly lower due to all 3 modalities being used in one treatment. Apply a thick layer of clear ultrasound gel on top of the client's skin. Place the applicator on the skin, ensuring that the applicator is flat and in complete contact with the skin before you hit the trigger, and perform a 20% overlap. Perform the treatment in a vertical motion, tracking where you have already gone. Start on the right lower quadrant of the face. Next, treat the left lower quadrant. Treat the nose individually. Next, the temple and end on the forehead. In places where the client has a lot of pigment, redness, or vascularity, you may perform 2 passes. You may grab any excess gel off the handpiece itself and reapply to the face during the treatment. When finishing with IPL, make sure to immediately wipe off the ultrasonic gel from the applicator because it could freeze and it's very hard to remove. Remove the ultrasonic gel and the goggles from the client's face. Cleanse the area and then dry the skin. Now we're going to move on to freeze. Because of limited time, apply a thin layer of glide onto the entire face. Use a facial brush or a tongue depressor and keep the layer thin so the client can feel the heat. For extra caution, use the glide to cover any exposed area around the treated area to prevent burn in case the applicator comes in contact with the skin. Switch the machine to the RF handpiece and select the face on the screen to indicate which body part is being treated, and adjust the settings for comfort after the treatment starts. With Tribella, you are only working on the face for 10 minutes. Consistently check the machine for the temperature and time. Stay on one half of the face until the skin reaches at least 39 Celsius. Then switch to the other half of the face and get the skin up to reach 39 Celsius. Once both sides are at 39, you want to maintain this heat and go back and forth. You may need to turn the RF up to 40 to quickly heat the skin. Use small circular motions around the chin and the mouth. Lift up on the cheeks and use small circles on the forehead. Remove the glide with a warm, soft cloth and cleanse the skin thoroughly. Now we begin our Viva. Apply alcohol with a cotton round to the face and prepare for the Viva. On the Viva applicator, take off the dummy tip and put on a new Viva tip. On the machine, choose the Viva setting. Base your settings on the client's main concerns and follow the protocol sheet on the machine for the Viva settings. Consider lowering parameters due to using all 3 modalities with the Tribella. If treating an Asian client, there is a specific setting to use and no overlap is recommended. You can treat Asian clients on a half pattern if you are worried about causing any adverse reactions. Perform Viva in a horizontal pattern. Make sure to only overlap by 50%. Make sure all the pins are in full contact with the skin. Do not leave spaces in between and do not overlap the same spot twice. If you're unsure if you hit a spot, then skip the spot to prevent burning the client. The pattern should be done to stay in sequence to not lose track of where you already hit. Constantly check to make sure you are not lifting the gun before it's done and there is full contact at all times. Check your pattern so there's no mistakes. Be consistent and careful. Under the eye, you can go up to the lash line as long as you can pull the skin down onto the orbital bone. As long as you can pull up onto the orbital bone, you can go under the eyebrow or on the actual eyebrow if it's not tattooed. Once finished with the Viva treatment, take off your used tip and immediately throw it away in the sharps container. Do not apply any products on the client's skin.